Hi there, my name is Dina Simpson and I'm the principal over at Monroe Center Grade School. And with me today I've got Kayla McKinney. She's our Director of Health Services. Hi Kayla. We were talking earlier last week and we were having some conversations via email with the leadership team and so forth. And I've noticed myself every time I've read some of Kayla's emails or some of the things that she's been sharing with us from Health Services that came a sense of calm. And I thought maybe perhaps it'd be really great to share out some of the Q&A that a lot of the community parents and staff have had if we share it out in a video format. And so I reached out to Kayla to say, hey, do you think you'd be willing to do this? And of course, she was willing to help me out and humor me a little bit. But we thought first about getting together and doing it like an interview format, wearing masks and so forth. And the more we thought about it, we wanted to send this information out in a more personal way, since we were reaching out to do it in something that wasn't typed up to share with the district. If we're trying to reach out past typing and text, then we probably should do it in a personal format. So we separated and are doing it on a Zoom meeting so we can have that personal contact with you in this way. So what I'm going to do, there are several questions that have come up in the community with our staff and probably I'm sure with parents and so forth, that we'll kind of go through like a Q&A, and Kayla's going to do her best to help us out in understanding all of the things that we're doing in the district to help create that safety and the wellness for kids and staff. So I think one of the biggest things that we've talked about as a district and with the leadership team is how are we going to screen children and staff for the symptoms of COVID-19. Kayla, can you tell me about how we're going to do that each morning?
Yeah, so we're going to have a really convenient way for parents to self-certify that their child is free of symptoms. And that's going to look like clicking a link that the district sends out each day. And you'll just have to answer a few short questions, verifying that your child doesn't have any of the symptoms of COVID-19. And through this program, it'll generate what's called a fast pass. And you will be able to show that to the bus driver when they get on the bus, or you'll be able to show it at the front door when your child is dropped off. If there is a reason that a parent wouldn't be able to self-certify, we will be screening them for a temperature when they get to school, and we'll be checking to see if they have any of those common symptoms of the virus.
That makes it sound a little bit more simple for especially when the kids are getting on the bus or actually arriving at school, for both the students to not be worked up about any of that stuff, or actually for the staff as well to know what we need to do and what we need to look for. So I appreciate that a lot. So then the next question always comes next with what do I do if my student has a fever or they're experiencing symptoms? What do we do? Where do we go from there?
So I think as a parent, you kind of know your child best. You may be able to determine when maybe they're just feeling a little anxious, or maybe they do have some true symptoms going on. We do want you to err on the side of caution. With our guidelines from the state, we're not able to have any student in the building who is experiencing symptoms of COVID-19. And we know that those are things like fever, chills, muscle aches, sore throat, headache, even down to like nausea, vomiting, everything like that. So you just want to make sure to be thorough and check in with your student each day and go through that self-certification process to make sure that they are starting their day off on a good foot.
So you alluded to something in terms of you started listing off some symptoms and so forth. So those of the community out there that know both Kayla and myself, Kayla has a 4 and a 6-year-old, and I have a 19-year-old. So we have vast ends of the spectrum for our children and students and so forth. And so I'm certain as a parent, I know I always probably was maybe a little more sensitive to my son when he was at a younger age in terms of how he felt that day and when he needed to stay home. It seemed like those decisions may have been a little bit easier as they were younger. And as he's older now too, sometimes there are days that perhaps maybe they want to not be somewhere because they're trying to avoid something or anything like that. But let's talk about the symptoms a little bit more and get into that a little bit, like where we would be at in terms of, as a parent, what do I do? What symptoms am I looking for? And how do I know when to keep them home?
Yeah, so I think you just want to make sure to take the time and really think about what your student is telling you, how they're feeling. Definitely take their temperature to see if they have a fever, and just kind of look at how they look overall. Look in their eyes and see how they're feeling. Um, we will err on the side of caution, and maybe if you're not sure, if you have a question in your mind, we would ask that you keep them home and partake in the remote learning curriculum for that day. And you can also reach out to your child's doctor and ask them for advice. You could also call your child's school nurse and see what they have to help you with.
So that leads to the next question that I'm sure everybody is concerned about. I know we were as well, in terms of how long does a student need to be out of the building if they're experiencing symptoms, or what do we do at that point as a parent?
So the length of time they're out of school is going to vary depending on their symptoms, if they have a fever or not. Sometimes kids will even have to be out of school just based on exposure to another person or family member or student who has tested positive for COVID-19. So we would just ask that parents rely on the guidance that your physician gives you and the health department. We're going to be in communication pretty much every day with the health department when we start up school, because we have an obligation to relay any student or staff member who is experiencing symptoms. We need to relay that information to them. So from there, they follow up with the family and talk to them about getting tested and kind of give them the okay to return to normal activities.
So then when they're out, and they're actually having absences for COVID-19 or they're quarantined, are they penalized for that at that point in terms of attendance and so forth?
No, so we won't be penalizing anyone for an absence related to COVID-19. We want to make sure that we're being as safe as possible, and allowing families that time to stay home and quarantine when they need to. And we would give the student the opportunity to do remote learning for however long they're out, as long as they're feeling okay. If they are diagnosed with COVID-19 and they have symptoms, we definitely want to allow them to rest if they need to. But if their symptoms maybe are mild or maybe they're asymptomatic, then we would definitely want them to do the remote learning for the day.
So then error on the side of caution would be the best practice in terms of how a child's feeling and whether they participate, if they're home in quarantine or COVID-19.
Yes, definitely.
Great. So like the next question that I had for you that I think everybody's asked, and I think it's been asked in so many different variations, and really there's just one simple answer for it, but I think that we should cover it in this Q&A because I know there have been questions in the community and everybody has certain beliefs about situations and whatnot, which is again somewhat of why we're doing this little Q&A, because no matter what, ultimately the safety and wellness of our students and our staff is like of utmost importance to us. So the question that everybody asks in various ways is my child required to wear a face covering or a face mask?
Yes. So as a district, we've made the decision to strictly follow IDPH, which is the Illinois Department of Public Health. We're following their guidance that they give us because we believe that they're the experts in this realm and we want to rely on their guidance. So yes, face coverings or masks are required for all students and staff members when they're in the building, regardless of if you're able to get that 6 feet of social distancing in. Times when the mask could be removed is when someone is eating or drinking, but in those cases when someone would have a mask off, that 6 feet of social distance or more would have to be strictly adhered to. And the mask may be removed when you're outside as long as you are able to get that 6 feet of distance between you and anyone else. Some things to think about sending your child to school with masks are make sure you wash them regularly so that they have a clean mask and are getting that clean air in. And label your students' masks with their name and their class to make sure they're not getting mixed up. Hopefully everybody has their own fun prints and that can help your student know which one is theirs, but just in case someone has the same one. And you'll also want to send extra masks with your child to school, because we want them to be able to just throw on a clean mask throughout the day if theirs were to get soiled.
That's a good point. I hadn't thought about that originally in terms of having a few extra masks and so forth. And in case anybody is worried, I know we will have coverings in the buildings as well if we ran into emergencies or something like that also. You had mentioned when you were talking about masks and what we're following, the protocol and so forth, and partnering with the county health department, that leads to the other question where there's a lot of people and the unknowns are probably what make things most difficult to know, what decisions are best for your children and so forth. What about, how do we know when a district gets shut down, our district in particular? How are we going to know when to do that?
So each of those situations is going to depend on a lot of different factors. It'll depend on how many students or staff members are diagnosed with COVID-19. It will also depend on things like how well social distancing was adhered to, making sure that everyone is wearing masks. And we're going to be in very close contact with the health department on these cases, especially where any positive case in our district, the health department will know about, and they will be in contact with us. So it's just kind of a case-by-case basis, and we're just going to make sure to work jointly with the health department to make those decisions about maybe when a classroom needs to quarantine or a school might need to close, or maybe even the district.
Awesome. Thank you for clarifying that. So there's a couple of things. I think we're going to wrap this up, but I think the best way to wrap this up is to share with everyone out there what just some of the things that the district is doing to provide precautions and so forth in terms of what we're doing for students and staff to make sure everybody is safe. So I'm going to share a few things that I noticed that we're doing in the building that we're being really cautious of, and then Kayla's going to share some things that we're doing as a district, district-wide for kids as well. So I know already I've had teachers in the building starting to work on their classrooms and so forth. We've been very cautious about the spacing and everything like that. We've been really working on class size, so there's been some changes made in terms of teachers and so forth, which has been really great because it's going to allow for us to do the spacing that we need to create for students. We've been talking about alternative ways to do physical education and so forth in terms of allowing the kids to have those space breaks in order to take their face masks off outside with the distance in mind, because recognizing we have not taken out of consideration the fact that they are children, and we are doing everything in our power to make sure that we acknowledge that and try to make the experience as best as we possibly can, because we know they're going to take our lead. So how we approach everything, they're going to follow with us in that respect, and we appreciate that as well. So I'm going to let Kayla kind of take it over and share some other things. I know buildings and grounds, we're doing the deep cleanings on Wednesdays when we get back. We're going to do individual cleanings at night in terms of the building and the classrooms. We are also going to teach the kids how to clean their masks. Kayla referred to that earlier because I think it's really important for them to take that ownership as well. And we're also going to be working on, helping the kids know their spaces to clean up and making everything sanitary and making sure that we do the simple things that we know we can do all the time, washing hands, making sure we're not touching our faces, the things that on any regular day would be super helpful to not spread germs and bacteria. So from there, I'm going to let Kayla take it over, and we'll get things wrapped up.
So I think the main thing that we're doing is just making sure that we're adhering to those IDPH guidelines as closely as we can. Some of the main things in those guidelines are the face coverings, the masks, social distancing of 6 feet whenever possible. And just, I know, like Dina mentioned, our buildings and grounds department is going to be cleaning every chance they get, trying to make sure it's as clean as possible of an environment for our students. And with that Wednesday deep cleaning, that will allow the classrooms, halls, bathrooms, everything to be deep cleaned before there's another set of students in the building. Other things we're looking at specifically in the health services department is we're looking at adding a health aide in each building. We're so lucky to be able to have a registered nurse in each of our buildings, and now we have a need to add on to that and add a health aide to help us with all these situations. So I think the biggest thing is just recognizing that wherever each individual person falls on on the continuum of where they're at kind of with the pandemic is just recognizing that the district needs to take all these precautions that we can and just really try to make sure we're making the safest environment possible for everyone's students.
I want to just take a second to thank Kayla for joining me to do this today, because we've really been thinking about it over the week, trying to figure out how to do this. And I also wanted to say thanks to everybody out there that's listening to this. Feel free to share it with your friends, the community members. And I wanted to take a second to thank everybody at the district level as well. I've been at every single one of the board meetings, and I can't imagine the amount of insight and thought that goes into making all the decisions, albeit every single answer is hard and nothing has been easy, but I appreciate everything that they've done to help create an environment for us to come back into the buildings and feel supported in that respect. So hopefully as we find other things that we want to communicate out to you, we can do maybe a little bit more of this Q&A, but I really appreciate you coming in, Kayla, and helping me out with this a little bit too. So thank you, everybody, and we hope you have a great few weeks. We cannot wait to see you all.
Thank you.